Well, our pets are like our family, so when they don't feel well or an accident happens, you'll do anything to make them well.
Oh, for sure. And it is nice to know that there are options for immediate medical attention at an animal ER. And here from the University of Illinois Veterinary Teaching Hospital, we have Dr. Megan Fick, a specialist in veterinary emergency and critical care, as well as Dr. Danielle Martindale, a veterinarian, completing her third and final year of residency. And then, of course, we cannot forget sweet little Max over here. Welcome to everyone. Let's talk about ER services when it comes to the University of Illinois Veterinary Teaching Hospital. This is a great service for people who may have an emergency when something's going wrong with their pet.
Yeah, so our emergency room is open 24/7. It is very similar to the way a human emergency room works. So we have doctors and nurses that are there 24/7, and they're able to help answer questions as well. So if anyone is not sure whether or not their pet, whether it is an emergency and whether it's something that should come in at midnight or 3 in the morning or on a Saturday afternoon, we're always there to answer phone calls and help figure out which of those patients need to be seen as well.
Yeah. I feel like one of the hard parts with having a pet, or even as a human, I feel like you deal with this too, but deciding when to go in versus like, let's wait it out, let's see how things go, let's see how they feel a little bit later. How do you decide, okay, I think it's time to take them in?
Yeah, so there are some things that we definitely would consider an emergency. So any sort of trauma, whether it's like a dog fight wound or something, you know, a pet's hit by a car, anything traumatic, a collapsing event, any animal that's having difficulty breathing should come right into the emergency room, seizures, things like that. So those are all things that we would want to see right away. Then, of course, there are like other conditions that are more urgent than emergent, and then those patients that are stable. So we triage the patients right when they come in. So we can first do the phone triage where we answer questions on the phone. And then once they come in, we will examine the pet right away. And we kind of put them into one of 3 categories: emergent, urgent, or stable. And so the emergent cases, no matter what order they come in, we will see right away. And the urgent cases are more so like the ones I just talked about. Yeah. So we're happy to see the urgent and stable cases too. They just may have a bit of a wait.
Right, because that was going to be my next question, is why is the wait so long? But I think you kind of answered that when you go by necessity here. Dr. Martindale, what has the ER been like? Has it been a busy summer for you all?
Yes, the summer is our busiest time of the year by far. People are the most active then, so we oftentimes see kind of the most accidents of things happening, like the hit by cars, you know, other environmental kind of things, or people are having parties, dogs eat things they shouldn't do, you know. So the summer has been very, very busy, and like Dr. Fick said, you know, we could have 5 patients get there at the exact same time, and the wait time may be different for each of those patients depending on which category they're in, which is hard for, you know, pet owners to understand, because everyone is concerned, because we all love our pets.
Right.
Sure.
Everyone is always really, you know, concerned, and you don't know what's going on because they can't tell you.
Yeah.
And so that's where we come in, is making that assessment, and then we try to update the owners as soon as we can to let them know kind of what kind of wait time that they're looking at based on which category they fall.
That's probably helpful for peace of mind of like, okay, this is where we're at. Now, what is an urgent care practitioner?
Yeah, so an urgent care, this is going to be a new service that we are able to offer at the U of I, and essentially coming to the ER, we are open 24/7, but we are staffed with specialists. So Dr. Martindale will be a specialist within a year, and I'm a specialist now. And the urgent care is going to be similar to that of a human urgent care. So our urgent care service will open on September 12th, and it will be open Mondays through Fridays from 10 a.m. to 6 p.m. Mondays through Thursdays, I think. Yes. Mondays through Thursdays. And, oh, perfect, it's on there. And so they're going to see more cases that you would feel comfortable, you yourself, going into an urgent care. So itchy skin, ear infections, diarrhea, vomiting, things that you wouldn't walk yourself to an emergency room for.
Yeah.
Genius concept.
Yes. All right. Well, Max, you were a little star there, just so patient and sitting there. I feel bad that we didn't get to visit with you.
Yes.
So, yes,
Adorable.
Thank you. Thank you so much for coming.
Yes, thank you. To learn more about the emergency services offered with the University of Illinois Veterinary Teaching Hospital, or the new urgent and convenient care service coming later this month, we'll connect you with all you need to know at our website, ciliving.tv.